Are you thinking about buying a collagen supplement or collagen cream, hope it would fix your stretch marks? You are not the only one. Collagen products are everywhere right now, and my patients ask me if they should buy them to help their stretch marks. Here is the truth most people do not want to hear, guys. Collagen supplements and creams are not an effective treatment for stretch marks. So, why is that? And what can you do instead to get rid of your stretch marks? Hi, my name is Morgana Colombo, Dr. Morgana Colombo. I'm a board certified dermatologist in Northern Virginia and founder of Vida Derma, a science-backed skincare line aimed to help women as they age. So let's start with what a stretch mark really is and understand why collagen does not work and what treatments do work. A stretch mark, or what we call striae distensae in medicine, is a type of scar. It forms deep in the dermis, which is the thick middle layer of your skin. When your skin stretches too quickly, whether from pregnancy, puberty, rapid weight gain, or even muscle growth, the collagen and elastic fibers in that layer literally tear apart. The structure of your skin reorganizes. Early on, stretch marks look red or purple. Over time, they fade to white or silver. But the underlying damage to the skin's architecture stays there. So why doesn't collagen work for getting rid of stretch marks? Collagen is a very large molecule. Under normal conditions, it cannot penetrate through the outer layer of your skin called the stratum corneum and reach the dermis where the damage actually lives. So when you rub a collagen cream on a stretch mark, the collagen mostly just sits on the surface. It may temporarily hydrate your skin or make it feel smoother, softer, but it's not rebuilding the torn fibers that are underneath because it doesn't penetrate, guys. Researchers are working on advanced delivery systems like nanoparticles and liposomes to push collagen deeper into the skin, but these are experimental and not what you find in the stores right now. Now, what about oral collagen supplements, the powders, the pills? There is some clinical research showing that oral collagen peptides can potentially improve skin hydration and elasticity in aging. But here is the important part. Those studies looked at general skin aging, things like fine wrinkles and dryness. They did not study stretch marks. A stretch mark is a scar, not just aging skin. And a recent meta-analysis found that when you look only at high-quality, independently funded studies, the benefits of collagen supplements on skin did not reach statistical significance. So the evidence is mixed overall, and it simply hasn't been shown to repair the kind of deep structural damage that defines a stretch mark. In my practice, I see patients who have spent months taking collagen supplements, expecting their stretch marks to improve, and they are understandably frustrated when nothing changes. The issue isn't effort, it's that the product doesn't match the problem. So what actually works for stretch marks? Let me walk you through what the science supports. The treatments with the best evidence for stretch marks all work by triggering your skin's own healing response deep in the dermis. They cause controlled micro injuries that stimulate your body to produce new collagen and remodel the scar tissue from the inside out. Microneedling is one of the most well-studied options for treating stretch marks. It uses tiny needles to create microchannels in the skin, which triggers collagen production at the dermal level. Studies show that most patients see at least 50% improvement after just a few sessions. It works on both newer red stretch marks and older white ones, and it's safe across all skin tones, which is a big advantage because some laser treatments carry higher risk of hyperpigmentation or discoloration in darker skin. Fractional lasers, particularly the fractional CO2 laser, are another strong option for treating stretch marks. These create tiny columns of controlled thermal injury in the skin, prompting significant collagen remodeling. Research shows they are effective at reducing the width and the depth of the stretch marks. They can be combined with other treatments for even better results. So, radio frequency devices deliver energy into the dermis to stimulate collagen production without breaking the skin surface. Some studies have found that radio frequency, especially when combined with topical tretinoin, may offer the highest rates of clinical improvement and patient satisfaction when it comes to stretch mark treatments. So topical tretinoin, a prescription retinoid, has shown some benefit for newer red stretch marks when used early. It works by increasing cell turnover and stimulating collagen synthesis. It's not as effective on its own as the procedures I just mentioned, but it can be a helpful addition, especially in the early stages. And it's not a procedure, which some patients may actually prefer. One important thing to keep in mind when it comes to treating stretch marks is that newer stretch marks, the red or purple ones, respond better to treatment than the older white ones. So if you're noticing stretch marks forming, that's actually the best time to talk to a dermatologist about your options for getting rid of them. Stretch marks are scars that form deep in your skin. Collagen creams can't reach that deep, and oral collagen supplements have not been shown to repair that kind of damage. The treatments that work, like microneedling, fractional lasers, and radiofrequency, do so by triggering your body's own collagen building process right where the injury is. So if stretch marks are bothering you, have a conversation with a board-certified dermatologist who can evaluate your skin and recommend the right approach for your specific situation. If this was helpful, consider subscribing for more evidence-based skin health information, and drop a comment below if you have any other topics you want me to cover. I will see you in the next video.